Imran Garda, thank you so much for joining us from Istanbul. Before I get to the situation in Turkey itself, since you spent so much time reporting and covering the problem in Spain and how Spain is really worried that it could be taken as the next Italy in the sense of the pandemic spreading to such a large extent, such a large number of people. What's the sense you get about how bad the situation in Spain is?
Thanks, Amitabh. Yes, we've been focusing on continent to continent, country to country, and most recently we've been looking at Spain and speaking to health experts, political experts, and journalists within Spain. They're obviously really worried because they've almost flown under the radar when you compare them to Italy over the past few weeks, but their numbers are creeping up very dangerously close to Italian numbers. And on the one hand, they're doing a lot of soul searching and trying to figure out why they were maybe too relaxed about all of this once they already knew there was the danger of COVID-19 spreading. So whether that was authorizing the march in Madrid, whether that was allowing the travel of football fans, the Valencia fans, to northern Italy to play that game against Atalanta. So there's a blame game. And they're saying, okay, well, as it may, we're in a situation where the numbers are horrible and we're afraid. So Spain has unique circumstances because it has these 17 autonomous regions, or the 17 different regions which all administer healthcare differently. So coordination is a big thing. And politically, it's not a country where everybody has been on board in the past few years. For example, the Catalonia independence referendum and so on, right? So you have this tussle between Madrid and the regions. So they're trying to coordinate more. And just like Italy, one of the disturbing things for all of us around the world is that these are countries with world-class healthcare systems, right? So if these are overstretched, if you have doctors and nurses and anesthesiologists and so on who are lacking basic PPEs, if these hospitals are overwhelmed and people are dying in terms of massive numbers, 500, 600, 700 every day, it's a worry for the rest of us around the world. So the foreign minister has said that they've turned the corner. He hasn't used those words exactly, but he said the numbers are slowing. And that could be a false dawn. Maybe that is maybe a reason to hope that things will stabilize. But yeah, they do have these almost existential fears that they are the next Italy, or the country that's going to be the one with the highest death toll. So Spain is definitely a country for all of us to just keep an eye on, and the numbers are terrible, and we just don't know with this virus, and that makes it all the more difficult and makes it it makes it one of those unique situations in human history where no expert is right, and we just have to keep on figuring this out as we go along.
An interesting point you brought up there about it is one state, Spain, but the 17 autonomous regions, as you pointed out. Now, India is also a vast country with so many states. They all have their own healthcare systems at various operating levels. So it's something to be really scared about in comparing it to Spain, which is world class, especially top class in Europe itself. You were pointing about how overstretched the system is, the healthcare system. And I saw one of the reports on TRT, which suggested that an emergency room, which is supposed to be catering for only 60 people, was having to deal with 600. So magnify that to the whole country, and it is absolutely scary.
Yeah, if you have a look at some of the reports from the main hospital in Bergamo in Italy, whether it was Sky News, Channel 4, and others, it's apocalyptic, right? It's insane. You're seeing people in the waiting rooms, you're seeing people in the hallways and the passages laid out, and there are those knock-on effects that people fear that you might even go there for something else and end up getting coronavirus. You might ordinarily have been okay even if you have mild symptoms or moderate symptoms of coronavirus, but the hospital might not have the capability to actually treat you properly because they're just completely swamped and overwhelmed. Healthcare workers themselves are getting coronavirus. So That's an example of how bad things can get. And as you say, I mean, you give the fears about India and elsewhere. These countries, Italy, Spain, South Korea, and so on and so forth, we, even though they've dealt with it to varying degrees, and there's criticisms in the US, they didn't have enough testing and so on. Within these countries, there's all various disagreements and arguments. The countries near the top are all, if you sort of exclude China, and I think China's a special case, but if you look at the countries near the top, they are all countries with world-class healthcare facilities, and they're all countries where a big form of testing has occurred, maybe some not as much as others, and also countries with free press and general transparency. So then that begs the question, through lack of testing in some places, how little do we know? But also in some places, are they underreporting? In some places, do we actually know the figures? So this is worrying, right? So when we follow Worldometer or we follow Johns Hopkins, it's, in a way, it's very difficult to sort of follow the numbers equally, because each country is very different in how the numbers will get disseminated. So you don't actually know that when a country says its first case was 10th of February, you don't know if 10th of February was actually, I mean, maybe it's its best guess, 3rd of January. So that makes it difficult to follow up on the effects of it, but also then looking for a solution within specific countries is, or looking to mitigate the damage, is all the more difficult.
Again, when you mentioned Spain doesn't want to be seen as the Italian model, so not model, but case.
Yeah.
One thing where it's very similar, again, apart from the healthcare system, is the number of elderly. Now,
Yeah.
Italy is the second oldest population in the world after Japan, but Spain is also up right there, 20% above 65 years old. Is that a factor as well?
Yeah. Yeah, but that's what they're saying, that's a factor as well. So you have the double-edged sword of having a healthy society. So when you have a healthy society, you
The
have
highest life expectancy in the world.
you have high life expectancy. You have a lot of old people who are living an okay life in their 70s and 80s and even 90s, which is great. But the problem is when they get hit by COVID, it makes them all the more susceptible, or there are more people in the population who are likely to get hit by COVID. But then there's a couple of mysteries here, right? So you think about, as you mentioned, Japan. Japan doesn't have that rate of that high rate of death that we've seen with the Italians, with the Spaniards. Is it because Japan clamped down just so well early enough? Is it because with Italy, as they were saying, a lot of young people work in the cities, they go back to the suburbs and the rural areas to be with their families, especially over spring, as things were in early March. You then see them intermingling with their parents and their grandparents, and culturally as well, they're closer to their parents and their grandparents. That could be a case. But then there's also some studies looking at whether some countries that have been hardest hit, those who have been hit by it have received a higher dose of the actual virus. Another thing, right? So, I mean, that's why healthcare workers are dying as well, young healthcare workers in the UK and so on, right? Because they have that close interaction with people who have been hosts and who have given it to them. So there's a lot of mysteries. Yes, I think as a basic idea, with an elderly population, with a population that's generally older than others, you're more highly susceptible because that's who the virus hits hardest. But then there are so many other crucial factors that I think we're just beginning to understand. And hopefully we'll understand it faster, because we need to get hold of this thing. But I don't think it's the only factor when it comes to Spain and Italy that old people, or that their death rate is so high because they have so many people in the population who tend to be older.
When you talked about the healthcare system being overstretched in terms of equipment, now not
Mm.
human resources, but the equipment, ventilators, PPE, masks, whatever
Mm.
else is needed, was a lot of it sourced initially from China and other NATO allies? And is that an issue because some of the equipment from China even turned out to be faulty and was returned?
Yeah, so that's been another thing. So we've heard of equipment that's come in and that they've said this doesn't work, or even with the testing equipment, they've said what only 60% works, so they've chucked out the rest or returned it. So I mean, these things are we don't know exactly, and it's difficult to actually know about the supply chains and exactly how they sourced all of this up until this point. So forgetting Europe for a second, even within the US, you would think, yes, the US has its debate over private healthcare versus public healthcare, and Bernie Sanders wants universal healthcare, and others are saying no, it's not part of being American, and so on. So that healthcare debate aside, you have the wealthiest country in the world with a shortage of ventilators, with a shortage of PPEs, with a lack of testing kits and the lack of the capability to actually mobilize testing kits fast enough, right? So you have that in the US, and naturally now you've had that in these big European countries where you would have thought they would have been better at this, especially after a month or two. Once the World Health Organization and others came out and said, okay, this is a global pandemic, you would assume that these countries would be able to quickly just switch things around and switch to emergency supplies or have enough stock normally, but they don't. And so that's another broader, almost philosophical question about once all of this dies down, eventually, once we come through on the other end of this, how do we want to restructure our societies, and are we were we always this fragile globally because we didn't pay as much attention to the basics, not as much as we should have.
Yeah, that's the point that's being raised again and again. When you look at, say, Taiwan or
Mm-hmm.
Singapore, they've been preparing for 17 years since SARS.
Yeah.
But again, since you're in Istanbul, I also wanted to get a sense of what it's like with Turkey. Are you slightly behind in that curve? Where exactly are you positioned?
Turkey's first official recorded case was March the 9th. So, with that in mind, out of as we speak, Turkey is in the top 10 of countries, in terms of the numbers, not the death toll, but infections. Now, with that in mind, it is the country with the most recent first case out of all of them, which is worrying. And we get addicted to this stuff. We go and look at the charts and we look at where everybody is, and everybody's doing that. Financial Times has some really interesting ones. Johns Hopkins has some interesting ones. Worldometers. So when we look at that, Turkey is very sharply going up. So every night, the health minister, he will announce the numbers of infected, the numbers of recovered, the amount of people who are in intensive care, the amount of people who are intubated. And the numbers are not good, just like everywhere else. Every day, it gets bigger. And sometimes it almost seems to be rising exponentially, but that's not exactly every day. So with that in mind, there's a worry here that, okay, maybe we were late to it, but the rate of infection is just too high. And so yesterday, the health minister started to specifically divide it among geographic regions. And so Istanbul is the worst hit, which isn't exactly very surprising because it's a mega city with more than 15 million people, a lot of densely populated parts of it, and a lot of travelers in and out constantly. So there's a fear that Turkey is probably, yes, as you say, late to it, like so many other countries, but it's going through a similar trajectory. And there's the hope that because of the lockdown measures that have been in place for about 2 weeks, it's not an extreme lockdown. It's a lot of social distancing. It's only essential services. The streets are much quieter. There's the hope that we will start to see the effects of that very soon, because what we've seen with other countries is once they locked things down, a couple of weeks later, the rate of infection slowed down, and there was an ability to flatten that curve and to mitigate the effects of this terrible virus.
Imran Garda, thank you so much for giving us your perspective there on what's happening in Spain and Turkey. We really appreciate it, and stay safe.
Thank you, Amitabh. All the best.